What is dichlorodifluoromethane? Dichlorodifluoromethane, also called FC12, can be a colorless liquid or a gas. It has an ether-like odor. Below 75 degrees Fahrenheit, it is a liquid. Above 75 degrees Fahrenheit, it is a gas. Where can dichlorodifluoromethane be found and how is it used? Dichlorodifluoromethane is used as a refrigerant gas in refrigerators and air conditioners. Dichlorodifluoromethane is also used in aerosol sprays, plastics, and as an aid in detecting leaks. Dichlorodifluoromethane harms the ozone layer, which protects the Earth from the sun's ultraviolet radiation. Although dichlorodifluoromethane is no longer made in the United States, existing stocks are allowed to be used. This product is still made in other countries, including China. How can people be exposed to dichlorodifluoromethane? You could be exposed to dichlorodifluoromethane through breathing it if you are near a waste site containing dichlorodifluoromethane. You can also breathe it when it turns into a vapor from polluted water, or be exposed to leaks from an old refrigerator or air conditioner. Persons servicing this equipment can also be exposed to dichlorodifluoromethane. Drinking it in polluted water containing dichlorodifluoromethane. Touching water containing dichlorodifluoromethane. It is unlikely to touch liquid dichlorodifluoromethane since it is contained in closed systems unless they leak. Eye contact by touching the eyes with water containing dichlorodifluoromethane. Direct eye contact is unlikely. How does dichlorodifluoromethane work and how can it affect my health? Short-term health effects to dichlorodifluoromethane include irritated eyes and burning skin. Direct contact with the liquid causes severe eye pain and frostbite. Breathing the gas can irritate the mouth, nose, and throat. Exposure can also cause dizziness, lightheadedness, and make it hard to concentrate. These symptoms may occur immediately or shortly after exposure. Exposure to high levels of the gas can cause an irregular heartbeat or heart failure that can be fatal. Dichlorodifluoromethane has not been shown to cause cancer in animals, nor has it been shown to affect reproduction in animals. Some data indicates that long-term exposure can cause liver damage in humans. How is dichlorodifluoromethane poisoning treated? There is no treatment for dichlorodifluoromethane poisoning. A doctor will treat the symptoms. What should I do if exposed to dichlorodifluoromethane? If you touch dichlorodifluoromethane, wash your skin with water until the chemical is fully removed. Frostbite victims must get medical help immediately. Do not rub affected areas or flush them with water. Do not attempt to remove frozen clothing from frostbitten areas. If you get dichlorodifluoromethane in your eyes, flush your eyes with large amounts of water for at least 15 minutes. Get medical help as soon as possible. If you breathe dichlorodifluoromethane, get to fresh air right away. If breathing has stopped, artificial respiration should be given. Get medical help. If you swallow dichlorodifluoromethane, do not induce vomiting. Get medical help. What factors limit use or exposure to dichlorodifluoromethane? If drinking water is polluted with dichlorodifluoromethane, use bottled water or another water source. Avoid bathing and cleaning using the contaminated water. Is there a medical test to show if I've been exposed to dichlorodifluoromethane? If you think you were exposed to dichlorodifluoromethane, physicians can order a test to check for an irregular heartbeat. Your physician will determine whether the cause of an irregular heartbeat is related to dichlorodifluoromethane exposure. Technical information and resources can be found in the video description. The Poison Control Center can be reached 24 hours a day at 1-800-222-1222. DPH can be contacted at 1-888-295-5156.